Today we are going to be looking at a health disorder that is called diabetes mellitus. Diabetes is a metabolic disorder in which there are high level of sugar in the body for a prolonged period. In 2014, the World Health Organization estimated that 589 million people, both adult and young and older people, are suffering from this disorder called diabetes. We are going to be looking at three major types of this diabetes, which are namely, number one is the type 1 diabetes, number two is the type 2 diabetes, and the third one is gestational diabetes. Let us take it one after the other. The type 1 diabetes are the aspect of diabetes which result from body failing to respond to insulin due to damaged pancreas. When the body fails to respond to insulin due to damaged pancreas. So there's two organs that is mentioned here, or two aspects of thing pointing at this type 1, the pancreas and the insulin. The pancreas are the organ that is responsible for digestion of sugar in the body, while the insulin are the hormones that is being produced by the pancreas. They are the hormone that's being produced by the pancreas. So when this hormone is being produced by the pancreas, it is being used to fuel energy to the body. While the pancreas are the organ that is responsible for breaking down the sugar in the body. So when this organ is breaks down from doing its work, it will accumulate sugar that causes this diabetes in the blood cell. Having known this type 1 diabetes, we move to the second one, which is type 2 diabetes. This type of diabetes is when the body fails to respond to the insulin produced. When the body fails to respond to the insulin produced, is when you have this disorder. Just as I said earlier, insulin is a hormone produced by the pancreas, and it regulates the blood sugar and also distributes this sugar to the cells for energy. So when the body refuses to respond to the insulin produced, when the body fails to distribute or to break down sugar and distribute to the cells, this may accumulate sugar in the cells or in the body that causes this diabetes. And this type of diabetes is called non-insulin dependent. Non-insulin dependent. Why it is called non-insulin dependent is that the insulin is available, just that the body is not responding to it. That's why it is called non-insulin dependent. Nor adult onset. This is what this kind of diabetes is being called. And if you find 8 out of 10 people who suffer from this kind of diabetes, they are the people that are overweight, the obese people who are obese. They are the people who suffer most this kind of diabetes. The third one is gestational diabetes. It is known as pregnancy-induced diabetes. It is known as pregnancy induced diabetes, and it is mainly found in women who are pregnant with baby. This kind of diabetes is normally found in the women who are pregnant. Being diagnosed with gestational diabetes does not mean that the woman had diabetes or will have diabetes after giving birth. But a woman should follow her doctor or physicians provide information during this or during their period of pregnancy. Having known the type of the three type of diabetes, let's see what could be the causes of this diabetes. Number one causes of this diabetes is overweight or obese. Just as I mentioned earlier, overweight or obese is the number one causes of diabetes. The second one is family history of gestational diabetes. Family history of gestational diabetes. So women who are pregnant, they are the one who suffer this diabetes, and due to the family history, the child of the mother, the child in the womb, can also inherit this from their mother through the family history. The third causes of diabetes is increased blood glucose level. When you are taking a lot of carbohydrate, sugary thing, and you are not exercising, you are not burning calories, it may accumulate to cause this disorder, diabetes. When you are not exercising and you are taking a lot of junk food, especially starchy food, these are the causes of diabetes. The other one is intake of alcohol. Large intake of alcohol, and most of the alcohol contain sugar. When you take it in large quantity without burning calories, you don't exercise, this also may cause you diabetes. These are the few causes of diabetes. If you can make your research, you see that there are more to this. But this is a few one I can capture for now that causes diabetes. What is the prevention of diabetes? What can we use to prevent this sickness that at almost 589 people, 89 millions of people who are suffering from this diabetes? What can we use to prevent, or what are the prevent measures? Number one is proper diet. Eating proper diet. I said it in my first video that your diet is the most important in your life. Your diet has 80% of your healthy living. So when you are taking your diet, you make sure that you take it according to proportion. You're eating right and taking the right proportion for you not to accumulate enough sugar in your body. Number two, for prevention of diabetes, number two is having exercise or taking exercise. And I've told you earlier in my other videos, time for exercise. I told you time for exercise. I told you duration for exercise. Exercise is also contribute 10% of your healthy living. So take exercise very serious. Take exercise very serious. The third prevention of diabetes is maintaining normal weight of the body. Maintaining normal weight of the body. When you see that you are getting fatter, when you be watching your weight of what you eat, and when you see that you are above your weight, go and do exercise. Burn down some calories. Burn down some calories so that you do not accumulate a lot of sugar in your body that will develop this sickness. Thank you for watching. Share this video. You may save a life by doing that. Thank you and watch out for my next update. Thank you.